Thank you, Mary. I appreciate that. Oh, it is my indeed pleasure to introduce today's keynote speaker, Emily Vorde. I'm not sure how many of you have had the opportunity to meet her yet, but she is an absolutely delightful person. And what I want to do first is share just a bit of her background. It's also online for you, so I'm just going to hit a couple of highlights, things that were jumped out to me. One is that Emily Vorde was born in South Bend, Indiana. I got to shout out for the Indiana nation out there. And then went to University of Notre Dame and graduated in 2015 with a degree in political science. But while she was at the University of Notre Dame, part of her interning was for office in the office of Mayor Pete Buttigieg. So way to go. Awesome. I'd love to meet Mayor Pete. But following all of that at Notre Dame, she wound up in her grad school, and Emily taught second grade in a self-contained classroom in Pascagoula, Mississippi. Wow, that's down close to us there, Emily. You can't get much further south. But then in 2019, she joined the Buttigieg presidential campaign. So moving up that ladder in the political realms. And now I'm thrilled to say that in May of 2021, Emily was appointed by President Biden to a role in the White House Office of Public Engagement as the Assistant Director and Administration's Liaison to Disabled Americans. That's a mouthful. That's a lot of cool stuff in a short amount of time too, Emily. One of the things I want to say before I bring you out to is how much we appreciate what you do in your role. I know that you've been gracious in meeting with April and the staff of April. We've met with you a couple of times and let you know that we're here for you. And I would like to now turn the floor over to you to introduce you to our wonderful April membership. So, Emily. There
there we go. Thank you so much, Billy. I cannot say enough good things about the folks over at April. Thank you for inviting me today and letting me join your virtual conference. As Billy mentioned, my name is Emily Vorde. My pronouns are she, her, and just to give you a bit of a visual description, I am a white woman with blonde shoulder length hair. Today I am wearing a blue and white checkered dress, and you can't see it in the frame, but I am a wheelchair user. I was born with osteogenesis imperfecta and have used a wheelchair throughout my entire life. So this work in the disability space is so personally and professionally important to me. It was when I was a teacher on the Gulf Coast of Mississippi. It was as I was advocating for my students in my classroom and those on the campaign trail. But again, most importantly, it is important to me here in the Office of Public Engagement in the Biden administration. So you might be asking, what is the Office of Public Engagement? So to steal a phrase from my colleague, Trey, we are the front doors of the White House, ensuring that the doors of the White House are thrown open to Americans across the country, and not just those that donated to the campaign, certainly not just those that agree with the president, not just those that voted for the president even, but to every single American in every nook and cranny of the country. And we do that by engaging around certain constituencies, certain issues, understanding that no single community or identity is a monolith, but that each brings unique, informed, shared experience to the conversation, input that informs policy and informs the posture of this administration. So I specifically, as Billy mentioned, have been tasked with leading the White House's engagement with disabled Americans across the country. And That includes both those and those of you that might look a lot like me that use a mobility device or a wheelchair or a walker. But it also includes our community members, also perhaps you at home, with invisible illness, chronic illness, mental health diagnoses, and most recently kind of what we've called the newest members of our community, those navigating the effects of this pandemic, the effects of long COVID. So we here at OPE, Office of Public Engagement, manage a bit of a two-way street. One, ensuring that we are communicating out information to you as quickly as possible, updates from the administration and the White House and from the president himself. I told the folks at April this ahead of the call. We are an equal opportunity office. Again, we want to hear from you and we want to be able to connect with you. So after our time today, I've asked the April folks to share out a link so that you can register to connect with me. I promise that I won't bug your inboxes too much, and that information will stay safe with me. But just giving me your email will allow me to, again, push out those updates. And the second piece of the work that we do here, which is really exciting, is creating space to share our platform, to share the bully pulpit of the White House. So bringing in voices from communities, from intersectional communities, to help inform policy and to shape the work that we are going to do in this administration. So for example, we've brought together roundtables, listening sessions with Indigenous disabled communities, talking to them about the unique challenges that they face at home and in their spaces. We've brought together groups of disabled teachers that teach students with disabilities to talk with them about their experience and how their work can inform our policy. We've brought together communities of color to have conversations around mental health and the barriers, cultural and attitudinal barriers that exist in their community. So these are just some of the few examples of ways that we are really relying on the American people to inform the work that we do. So that is a little bit of high level about me and about the work of the Office of Public Engagement in the administration's posture towards disability. But I want to talk to you a little bit about what this administration has done as it pertains to our community and kind of where we're going, what we have planned from here. And I will note that we will have time for some Q&A at the end of my remarks. So certainly, hold your questions, drop those in the Q&A, and really look forward to digging in with you there. I want to tell you with resounding confidence that this administration hit the ground running from day one in support of communities, disabled communities. So on literally day one of the administration, January 20th of 2021, the president signed an executive order on advancing equity and support for underserved communities, including communities of disabled communities. In that, the president writes, quote, "The federal government's goal in advancing equity is to provide everyone with the opportunity to reach their full potential. That includes directing the Domestic Policy Council here at the White House to coordinate efforts to embed equity principles, policies, and approaches across the federal government." It also directed the director of the Office of Management and Budget to study methods for assessing whether agency policies and actions create or exacerbate barriers to full and equal participation of underserved communities, again, including communities, disabled communities. Through the equity executive order, the president established a data working group to begin disaggregating data sets by race, ethnicity, gender, disability, veteran status, and other key demographic variables so that we can begin to better understand the cascading effects of policy on issues of equity for these communities. This executive order is thought of as kind of our external facing substantive commitment to equity for disabled Americans, again, from literal day one of this administration. That executive order was followed up by a second executive order on June 25th. The president signed an EO on diversity, equity, inclusion, and accessibility. You might hear it called the DEIA accessibility executive order in the federal workforce. So in it, he says, as the nation's largest employer, the federal government must be a model for diversity, equity, inclusion, and accessibility, where all employees are treated with dignity and respect, end quote. Something I want to pull out here in particular is that inclusion of the letter A, DEIA, and it is incredibly stressed throughout this executive order. The A, standing for accessibility, means the design, construction, development, and maintenance of facilities, information and communication technology, programs, and services so that all people, including people with disabilities, can fully and independently use them. Accessibility includes the provision of accommodations and modifications to ensure equal access to employment and participation in activities for people with disabilities. It reduces or eliminates physical and attitudinal barriers to equitable opportunities and ensures a commitment to people with disabilities, independent access to every outward-facing and internal activity or electronic space, and the pursuit of best practices for universal design. I know that that is a mouthful, and it is a lot of substance. But what it boils down to is a directive from the President of the United States to each and every agency and component in the federal government, asking them to come up with actionable plans for ensuring that they are meeting goals around diversity, equity, inclusion, and this accessibility piece. Access through communication, through physical space, and addressing any attitudinal barriers that might exist. So these two executive orders have really started us off from day one, prepared to approach and lift up and elevate disabled voices and ensure access, again, in the workplace and throughout the Biden administration's policies. So from there, I just want to give you a few other updates before we turn it over for questions. Again, with what the administration has done and continues to do to show support for our community. So right out of the gate, the administration passed the American Rescue Plan, or the president signed off on the American Rescue Plan, which provided states with billions in additional Medicaid funding for home and community-based services for the year 2021. The additional Medicaid funding helped to expand access to home and community-based services for people with disabilities, as well as older Americans, to ensure that caregivers are fully compensated for their work. The Centers for Medicare and Medicaid Services further released guidance on the use of those funds for HCBS, and the Administration for Community Living released an accompanying blog post and other resource materials, again, to amplify that investment of funding. But something that we say often around here is that additional funding through the American Rescue Plan was simply a down payment for the president's full ambition and support of a large influx of funding into the home and community-based service market. So what does that mean? In the president's Build Back Better agenda, he continues to be in full support of a $400 billion investment in the caregiving economy. As you know, if you've been tuned into the news, conversation about what boils down to the reconciliation bill is ongoing. The White House is actively involved with conversations with Capitol Hill on the provisions of this bill. And at this point, the president is not backing down from his full investment, full commitment to this home community-based service funding, because he knows, and we know, right, that an influx of Medicare and Medicaid funding is not only going to ensure grace and dignity and support for people with disabilities, but will also ensure that home healthcare workers, direct service providers are able to support or able to be supported by a living wage, the opportunity to collectively bargain, the opportunity to remain in this profession. We so frequently hear, as you all are intimately aware of, long waiting lists, unreliable, poor home health care service. These issues will begin to be remediated with the support of the Build Back Better's investment in home and community-based services. And we're just so thrilled for the support that we've seen and are eager in these next few weeks, eager and hopeful that we will have clarity on the text of the reconciliation bill, and we'll look forward to sharing that when we know more. But the bottom line is this plan will create jobs, will cut taxes, and will lower costs for working families, including those across rural America. And so, again, such specific support for our community, and we're so excited to have the opportunity to talk about it more when a deal is reached. I want to specifically point out, too, that the Vice President has taken time to better understand what she is calling and what many call the sandwich generation, which is a generation that many on the call might be a part of. And that refers to the millions of adults who are caring for multiple generations of family members with few or no formal support. This resource burden, that burden on the sandwich generation is further exacerbated, as we know, when family members' disability or disabilities necessitate around-the-clock medically complex care, right? It's not enough that a family member is willing to provide care for a disabled or aging family member. We need to be backing that up with training, with support to, again, ensure that we have resources available to provide high-quality care within homes, within communities, and that we're effectively filling that gap. Something I wanted to update you on that is actually just hot off the press as of today is a little bit around access to hearing aids. The competition EO executive order that was signed a number of months back committed to increased access of hearing aids over the counter. And just today, the FDA took the next step to making hearing aids available over the counter at pharmacies and at other regular retail stores without the need for a prescription, medical exam, or fitting. These steps will help millions of Americans with mild to moderate hearing loss get cheaper and more convenient access to hearing aids. About 37.5 million Americans have trouble hearing, but just 1/5 of them use hearing aids, in part, due in some part to the fact that they are so expensive and inconvenient to get, as, again, many of you all know. This is not just policy for our community, this is lived reality. As called for in the President's executive order on competition, the goal is to cut red tape and allow more companies to compete to sell hearing aids, which again, in turn, leads to lower cost and wider availability. We're hopeful that the rules around what this availability looks like will be finalized and take effect next year. With increased competition, we can expect hearing aids to cost hundreds instead of thousands of dollars, and expect more innovation in the marketplace so that consumers have more and better options. Again, making that access to assistive technology for those that need it, for those that desire it, more or less cost prohibitive and more accessible. The last piece I just want to update you on is the administration's approach to the COVID-19 pandemic, to the coronavirus. I know that has been top of mind for so many, particularly for those in rural America. And there's two pieces that I want to touch on. One is just the president's remarks that he has given over the past few weeks and the administration's ongoing work around booster shots and their commitment to getting what we call shots in arms, both initial vaccines as well as these most recent booster shot recommendations from the FDA and the CDC. So as recently as just a few weeks ago, the FDA and the CDC announced a recommendation that starting at least 6 months after your second shot, if you received the Pfizer shot, you can get a booster shot if you are at age 65 and older, at high risk for severe COVID or illness, or work in a frontline job like as a healthcare worker or a teacher. This commitment to booster shots and is an important step for millions of Americans and shows that we are continuing to listen to the science. We're continuing, we know that, that getting shots in arms reduces hospitalizations, it reduces death, and reduces transmission of the virus to members of our communities who can't get the vaccine. So this is such an important step, again, in ensuring that we are building back better, that we are rebuilding normal here, again, across America. This is the first group of people that are eligible for this booster shot. Again, those having received the Pfizer vaccine at least 6 months ago. The FDA and the CDC are continuing to evaluate data over the coming weeks. I think that we're close to some kind of news on booster shots for those who had received either the Moderna or the Johnson & Johnson vaccine, as well as further information and guidance around younger children, younger Americans, guidance around their receipt of the vaccine. So in conjunction with that, and again, in addition to this widespread commitment to boosting vaccination rates, agencies across the administration have also done a good deal of work to ensure that those who had COVID, who are now experiencing the long-term effects of COVID, have access to the resources that they need. So back in July, end of July, just around the anniversary of the Americans with Disabilities Act, some of you might have seen that the administration released a package of guidance and resources to support individuals who were experiencing long-term symptoms of COVID. The announcement came from kind of consortium group effort from the Department of Health and Human Services and the Departments of Justice, Education, and Labor, providing information about where individuals can access resources and accommodations. So just to summarize a bit, the guidance explained that long COVID can be a disability under various civil rights laws. Essentially, what that means is if you have the symptoms of long COVID and they substantially limit one or more major life activities, the traditional legal understanding of disability, you are likely entitled to protections under various civil rights law. So again, any symptom from long COVID that substantially limits one or more major life activities. It also provided guidance, this administration announcement back in July also provided guidance through the Department of Education's Office for Civil Rights and the Department of Education's Office of Special Education around resources providing information about school and public agencies' responsibilities for the provision of services and reasonable accommodations for children in school. So those that have disabilities that are returning to school that need provision of accommodations, as well as, unfortunately, children that we're seeing with the effects of long COVID. Further, the collaborative resource document provided information through the Administration for Community Living, released guidance on community-based services that can help people if they now need assistance due to the effects of long COVID. And then finally, guidance from the Office of Disability Employment Policy, ODEP at the Department of Labor, indicating how employees can go about requesting reasonable accommodations in the workplace if they are experiencing the symptoms of long COVID, and guidance, resources, tools for employers about what it means to provide reasonable accommodations, their legal obligation under the law for employing people with disabilities and ensuring that they have access to the supports that they need. So I know this was a lot of information at once, but I hope that this can be just the beginning of a conversation. And I hope that me joining you here today, sitting with you here today, is just a vote of confidence in the administration. Again, I would not be doing this work if I did not believe in the president's commitment, the administration's commitment to our community. I am confident that the president's Build Back Better agenda will better communities, including those with disabilities across the country, and get us to a place of fuller inclusion, fuller dignity, again, in the space of our choice, in the communities of our choice. So with that, I know we have about, it's my understanding, about 15 minutes, and I want to use that time to answer just a few questions from the group. Mary, if you want to hop back on and help us to moderate some Q&A, and please drop your questions in the Q&A box. We'll really love to hear from you and get to chatting.
Thank you so much, Emily. Yes, we actually, I mean, if you're willing, this session goes until the top of the hour. So
wonderful. Yes, please. Let's use it. Let's use it to chat. That's awesome.
Awesome. Well, we just really, again, appreciate your willingness to do this with us. This is an amazing opportunity. So I hope folks are going to take advantage of it. I'll go ahead and start. We do have one question from Susie, who says, many people cannot use public restrooms, medical offices, other public places because there are fragrance emission devices installed everywhere. It would cost very little to have them removed in some facilities and mark these doors as fragrances not in use. Is there anything that you could do to help approach this issue?
That is a great question, and I'm so glad that you raised it. So part of what I said at the top, the creation of this two-way street, the solicitation of feedback, of questions from you all is so valuable. That does not just go into a black box, right? What we do here at OPE is often involve our partners over in the Domestic Policy Council. I sit in OPE, but my colleague Kim Knoxted, who some of you might have had the chance to meet, is our Director of Disability Policy, and that is a fantastic question for her. And I say that not to dodge your question, but all to say that I would love to connect with Kim and then to get in touch with you. And I know, Mary, we talked about posting some of the answers to these questions on the website. Would most certainly love to follow up with Kim to see what I can find out, and then get back to your question. I can reach back out to you directly, and then get that published on the website as well. But thank you for your question. I'm taking notes here on the side and can certainly reach back out once I've spoken to Kim about what our approach, what our the feasibility of doing that would be, most certainly.
Thank you so much, Emily. And we will for sure publish any of Emily's answers that she doesn't give today on the website under this session's materials.
Awesome.
So we have another question from Becky in Wyoming. She's wondering, Would an amputation due to a blood clot because of COVID qualify under long COVID disability?
So I'm I'm not in the position to give you formal advice, but or legal advice, I should say, under protections under civil rights law. But what I can tell you is the guidance that we have been given and that is being implemented across the country is that if again the effects of long COVID are substantially limiting one or more major life activities, which is the traditional definition of disability. So all to say, yes, definitely yes. Whether that be an accommodation, Becky, I don't know if you are school aged or in graduate school, whether that be an accommodation in an educational facility or in the workplace, you would certainly qualify for accommodations. So what I would encourage you to do, there's an incredible resource called JAN that is supported, and I would encourage all of you to check this out. It is a resource through the Office of Disability Employment Policy at the Department of Labor. And JAN stands for the Job Accommodations Network. It is an online resource that I'm also happy to pass along to Mary for publish on the website or through for communication via email. But it allows you to connect one-on-one with somebody at JAN to talk through essentially what next steps look like, how you go about requesting accommodations, what supports are provided, when and when you do not need to disclose your disability or the circumstances of your disability. And that goes for provision of supports under long COVID as well. So would certainly encourage you to check out JAN. I am going to pull up the website right now. I'm sure that you can Google it as well, but just so that you know, the URL is actually www.askjan.org. So www.askjan.org. It's a phenomenal resource that gives you, again, direct guidance one-on-one about the specifics of your situation and what kind of provision, what kind of resources are available.
Thank you. That's so helpful. And we did go ahead and drop that Ask Jan into the chat itself, and we'll add it to the resource section. This one comes from an anonymous attendee. There is a great need for a searchable nationwide database for individuals and personal care attendants to post their needs and to be able to connect with one another. Is the White House doing anything to help facilitate this? Or is there anything that they can do?
That is a really wonderful question. For that question, I am not sure where we stand presently on a similar database, but my partners in the Administration for Community Living over in Health and Human Services, I think would be best to answer that question. And so again, what I'm going to do is get some answers for them on either whether a similar resource exists or whether one would be feasible. If there are any non-governmental agencies or organizations that help to manage such a list. So let me get in touch with ACL, Community Living, and get back in touch with you. That is a phenomenal question.
Thank you, Emily. We're just creating a whole bunch more work for you, aren't we?
No, this is like I said at the top. That is my role, is just making sure that you all have an outlet to somebody in the White House. Again, maybe not always to have the answer right off the top. I certainly rely on the expertise of my colleagues, but again, to get you in touch with people who do have the answer. So I am more than happy to be here and keep the good questions coming.
Awesome. Well, I've got just a few more for you if you're game. Jake Morris is wondering, what is the administration's plan to address stigma surrounding invisible disabilities?
That is such an incredible question. And Mary, you said it was from, who asked the question, was it?
Jake Morris.
Jake, awesome. Jake, thank you for your question. I'll start with just kind of a personal anecdote that maybe some of you can understand or relate to. So as I mentioned at the top of the call, you can't see it in the frame, but I use a manual wheelchair. So there is never any question, right, when I enter a room that I have a disability. The downside is, folks might see me with their preconceived notions about what I can and can't do, about my abilities, about my capacity, but there's never any question about my status as a person with a disability. I see that in a lot of respects, personally speaking, putting on my personal self-advocate hat as an immense privilege, because my status in the community is never challenged, or my need for accommodations is never questioned, right? People take me at sight. So what I am trying to do, and what this administration is trying to do, is to connect with folks who, of course, present with visible disabilities. That is so important, but also that to help normalize invisible illness. And again, with that comes chronic illness, comes cancer, comes chronic pain, endometriosis, Crohn's disease, even our deaf and low vision, or blind members of the community. That disability is not always noticeable upon first glance, right? It also involves, again, long COVID, to bring it up again, mental health diagnoses. So a vast majority of our community is navigating conditions that at first glance, at first perception, first impression, aren't necessarily noticeable. So yes, to answer the long and short of your question is this administration is doing a great deal to normalize, to promote conversation around both the prevalence and just the very real, unique lived experience of those with invisible diagnoses or invisible conditions. Speaking for myself in the Office of Public Engagement, I do a lot to ensure that any group of disabled stakeholders that I convene, any roundtable that I have, any opportunity to meet with the president or the vice president or our director, includes representation from communities with of invisible diagnoses. So for an example, some months back, we convened a group at the request of the vice president of advocates in the voting rights space, disabled advocates who are fighting for protection of the right to vote for disabled Americans. And traditionally, right, we think of barriers to the vote as being physical barriers, as being those that there being stairs to get into a polling place, or the polling box, the ballot box being too high for a person in a wheelchair to reach. That only scratches the surface, right? And is only part of the conversation, albeit an equally important part. But so what we did to kind of broaden everyone in the room's understanding, and including the vice president understanding of disability, was to bring those into the conversation with invisible diagnoses. We had an incredible self-advocate, Jalen, who spoke eloquently about her experience with mental health diagnoses in chronic pain. We had other members who, again, didn't visibly present as disabled, but who have diagnoses that are just as poignant, just as real, just as deserving of protection under the ADA and other federal law, and more importantly, just as deserving of a platform in this conversation. So know that we are doing a great deal. I would love to connect with you further and hope that, again, you would take up my offer to kind of join my distribution list. Any and all voices in this space are so incredibly valuable and valued by this administration. So I just really appreciate your question.
Thank you, Emily. I really appreciated your answer. This question comes from Joni Thomas. Will Medicaid be recognizing long COVID as a disability or just based on ADL limitation to receive support services?
I will get clarification on this. It is my understanding at this time that guidance has not been released on recognition of long COVID one way or another. But again, this is another great example of not me dodging your question, but being a middle woman to help you better understand, to all of us both, better understand where we presently stand with this guidance as an administration. So please let me get back in touch with you. I'll add it to my list of homework after this call to see if we have any current guidance on whether or not it will be recognized through our Office of Medicare and Medicaid.
And this follow-up might also go well with that. An anonymous attendee says that we have encountered several people we work with applying for SSI and SSDI benefits for long COVID related conditions. And they're wondering in your follow-up, who can they contact to assist with local SSA offices if they're unaware of what the status of approving benefits for these conditions are? So more of an advocacy question of who can they contact to really help those SSA offices do better?
Sure, most certainly. So when I follow up on where we stand with guidance on recognition of long COVID under Medicare and Medicaid, I will also get direct contact information for what the best avenue is for providers and for individuals as well. So I'll lump those together and get back to you with both guidance or status of guidance as well as best contact information for where folks can go for follow-up questions as well.
Thanks, Emily.
Mm-hmm.
This is a question again from another anonymous attendee. Could you tell us a little bit about what the administration is doing to advance the principles of nothing about us without us, putting people with disabilities in positions that oversee disability policy areas? For example, will the administration work with the Department of Justice to intervene in Olmstead lawsuits in some states? I guess maybe that's a two-part question. Yeah. Let me, on the last piece as it pertains to the Department of Justice, again, that is certainly not my wheelhouse. So let me follow up on that piece, and I can try to get some kind of clarity there. But let me start at the top, because I think your first question is a very, very good one. So what are we doing to ensure this administration is living up to the off phrase, nothing about us without us, right? Again, I keep saying this time and time again, but both sitting in the Office of Public Engagement and as a person with a disability, this is so incredibly important to me, and is something that I've been following closely. And I am so thrilled to say that this administration is committed to ensuring representation of disabled voices across in appointments across the administration. And this is where it's important, both in roles like mine that are very
disability specific, but also just putting folks with disabilities of all kinds, visible and invisible, in leadership positions, in junior roles, in mid-level roles across the administration, in roles even that aren't necessarily working directly with disability on a day-to-day basis. So for example, everything from making good on his promise, the president making good on his promise to hire a director of disability policy in Kim Knoxted to fill my role here in OPE, but also hiring folks at the USDA who self-identify as disabled to work in the communications shop, hiring folks over at Department of Transportation to work in the Office of Civil Rights, hiring folks with disabilities to, lead scheduling in advance work over at the Department of HHS, right? So it is so invaluable that we not only be siloed in specific or pigeonholed in specific disability focused work, but across the administration. And what I can tell you is right now, just a few weeks ago, the administration reported that we are presently at 6% of appointees self-identifying as disabled, that being up from 3% of appointees self-identifying as disabled at the 100-day mark. That is certainly progress, but is not going to lead to complacency on our end. There are still many appointments to fill. And I can tell you with full confidence that we are meeting as an internal working group every single week, sometimes multiple times a week, to talk about filling roles across the administration with disabled voices, with disabled representation. So we are committed to continuing to skyrocket that number up. And just really can tell you with confidence that we know that 6% is not enough, and that we don't stop here. So yes, phenomenal question. And again, something that I think so many of us here in the administration are personally invested in seeing is seen through. So. Mary, I think I probably have time for maybe one or two more questions if we have them.
Yes, we do.
Awesome.
Thank you, Emily. So I do have a few more. This one actually I think is an interesting one, and one that probably you can answer. Does the administration have a plan to help increase representation of the disabled in public offices?
Great question. So I think that a bit, again, is very tangentially related to the last question, which is, yes, we are working every single week with the Office of Presidential Personnel to talk about what it means to have disabled representation in agencies across the administration. And we are working to ensure that incredible talent pipelines, certainly not just here in Washington, D.C., but across the country, are tapped, that we are, finding senior level talent, mid-level talent, junior level talent, folks with disabilities who are willing and interested in joining the administration. We are planning to have in the next few weeks a really, really exciting event, something I'm looking forward to, which is just a webinar that I will be sure to push out to this network about joining, what it would look like to join the administration in a junior level role. Specifically as a person with a disability, we believe, right, that keeping that talent pipeline rich, kind of what we call building out our bench of people with disabilities, again, across agencies, whether that is in the National Council on Disability or in the Department of Education, that building out that talent pipeline of voices of disabled voices is so incredibly invaluable. So that conversation is ongoing. When that webinar timing is finalized, I will be sure to push out to this group. Would love to have you join in to, have you amplify to your networks as well. But know that we are always looking to ensure that our community is represented in every kind of corner and pocket of this administration.
Thanks, Emily.
Mm-hmm.
So this one actually is just another comment related to personal care assistance from Samantha.
Mm-hmm.
She just wanted to say, when it comes to hiring personal care assistants currently, low pay and no insurance benefits have been an issue for a very long time. The pandemic has really seemed to amplify this and is causing a health crisis. And she just wanted to make sure that, you and others are aware of that.
We are, and it's one thing for me to be aware of that, but what's more important is the president himself is aware of that. We hear time and time again, as you all know, that the pandemic in particular just put such a squeeze on the care workforce, on the care economy. It is not reasonable to assume there being the availability of high quality care attendants. If those care attendants are not being supported with the funding, with the resources that they need to survive, to support their families, to live comfortably, above the poverty line. So we are aware that, again, the president's commitment in the Build Back Better agenda certainly is in large part a commitment to disabled and aging Americans, but more so is a commitment, or I shouldn't say more so, in equal parts, in tandem, is a commitment to that care workforce. Again, we know that high quality care is directly correlated with care attendants that are trained, that are have the support and the resources that they need. So those are very, very linked in our minds, and we know that now so more than ever, that care workforce is just being really, really stretched thin, and that's why there's so much urgency around this proposed investment, and why we hope that through the reconciliation deal, there will be again, the president is not backing down from his commitment to this investment.
Awesome. Well, I think I have a great one for you to end on that might give you an opportunity to also plug a little bit about how folks can get involved with you.
Awesome.
But before I end with that one, I just wanted to mention there are a few other questions and comments in the Q&A that really relate to the Americans with Disabilities Act and enforcement of it, and of accommodations. And I just wanted to give a little plug to one of our conference sponsors who are here, are the ADA Network. And they are doing several different presentations and have a vendor tab with their contact info. And I just really do want to encourage folks with questions about the ADA and the accommodations to reach out to them. That's what they do and what they're really great at. And I always love just being able to plug others, but I wanted to end today with Ty Smith's comment / question. He's seen often that policy is made from people who don't understand the community it impacts, like urban cities creating legislation that is harmful for rural areas, or something that works in one, or state, and it gets started in another state without the proper supports. So how do you really get the full voice of people who are often not heard?
Thank you for that great question. As I said earlier, from day one, the president committed his administration to ensuring that we weren't just tacking on disability as an afterthought, as a lens that was added on, again, by non-disabled folks during the creation of policy. Instead, he committed to hiring my counterpart in the Domestic Policy Council, Kim Knoxted, who I work with and talk to every single day. way. And Kim's sole role is looking at, again, disability specific policy, as well as just any policy that is formulated out of the Domestic Policy Council. And she's using that disabled lens, both her professional training and as herself, somebody that self-identifies as disabled, to ensure that policies aren't harmful to our community, and more so help to lift up and support our community, particularly, intersections of our community that are most marginalized. So a large part of that is soliciting feedback, soliciting the voices of, again, Americans across the country to tell us what is important to them, what the lived reality of their community is, what they need from the federal government. And that's where I come in. That is my job, to convene those voices, to convene those listening sessions, to collect feedback, to be a connector to resources. And again, that is not all just me hopping on the phone or convening a listening session just for optics. That is, anytime we convene a group of folks, there is an output, whether that be a briefing with Domestic Policy Council or a press readout or whatever it may be, an opportunity to capture that feedback. So as Mary said, all to say, I really do want to stay in touch with you all through both my email, my regular email newsletter and distribution list, but also I just want to invite you all to reach out if you have follow-up questions, if you have, a perspective or a voice that you think is really missing in the conversation that you want to be, ensure is heard. That is what I am here to do. And just by your, participation today, your engagement with April, right, I know that you are committed to this work. And I just want to be sure that we are sharing our platform so that experience, that voice can be heard by decision makers in this administration. So with that, I will be sure to follow up. Mary, if you can help collect some of the questions that we didn't get to, as well as maybe the ones that we did, but we can just package those together and push them all out. And then, as I said, I will also share out a link to continue to be in touch with me. But in the meantime, thank you to all of the folks at April, Mary and Sierra and Alyssa and Billy, and to all of you on the line for your continued commitment to and engagement with this work. Know that you have an advocate and an ally in me and in this administration. So thanks so much, Mary, and look forward to talking to you all again soon.
Thank you. And at April, we have a saying that with community, we're stronger, and we are just really thankful that you're a part of our community. So thank you for spending your time with us today.
Of course, thank you. We'll see you soon.
We'll see you soon. And folks, please be sure to check back at this session on the website, and we will post answers from Emily as soon as we get them. That website will be open probably until January. And so feel free to keep coming back, checking recordings and the information we add. Don't forget to fill out your evaluation, and we'll see you soon.